Hello, everyone, and welcome to another live session with Dogtopia. My name's Tony. This is our veterinarian, Dr. Antje Joslin. She has more than 15 years of experience in the veterinary field, and we've received quite a few questions via our healthy dog site, dogtopia.com/healthydog. If you hadn't had the chance to visit, we invite you to visit and check out all the recipes, fun videos, DIY. We've put quite a bit of content on there for you pet parents to make sure your dog stays fit and furry for life in 2018. So let's get started answering some of these questions, shall we?
Yeah.
All right. The first one came from Peggy Foster Garcia via our Facebook page, actually. So if you have some questions and you want to submit them, feel free to write in the comments and we will answer them if time allows. So Peggy Foster Garcia asks, what do you think about CBD oil for dogs who have anxiety?
So good question. I actually get questions about this quite frequently. And, there's some anecdotal evidence that CBD may help anxiety. There's probably some behavior stuff that might use it, and definitely some people who are into alternative therapies. There are also lots of products on the market, but unfortunately, we don't have any good clinical research available at this time. It is still considered a Schedule 4 drug to test anything that comes from the plant itself. So even though CBD doesn't have any, of the it's not THC, It doesn't have any of those hallucinogenic effects. It's hard to get any research done on it. But Colorado State is doing some efficacy studies on cannabinoids for epilepsy. And I think they're going to do some for arthritis also.
Okay.
Sounds like I heard that through the grapevine. That was one of the next ones. But hopefully we'll get some good studies for guidelines that we can use, milligrams and the types of oils that we need to use in specific conditions. And hopefully anxiety will be one of them, because it's definitely a question that's asked frequently. In the meantime, there's also other good products,
For dogs with anxiety?
With anxiety, if you don't want to, go down that route or whatnot, because a lot of us are kind of leery to give you specific dosing on that because we don't have good guidelines, different size dogs and how they're going to react. So, we can do some other things. We definitely see dogs that do get THC and they do not do well. So, you have to be really careful. I mean, you get some dogs that get into people's
personal stash
and, they do not do well. They're just not, they do well when you manage them medically and stuff, but they're not, having a good time. They're definitely anxious and pacing and things like that. So, let's do something that maybe won't have those effects. So let's, you can try products like Zilkine and Soliquine. They work really good with cases of mild anxiety. They're natural products. So with those, I tell people, you have to use them 4 to 6 weeks at least to see some results.
To test.
Yeah. And sometimes you need to use them at a little bit higher dose than what's on the bottle. And if you have more serious anxiety than that, there's some prescription medications, like, we use things like Prozac and Xanax and all those things that you probably are familiar with on the human side. Well, those work really well with dogs. But we also always tell people, or I tell people, you need to do behavior modification with those, work with a trainer, and the dogs can have a lot of success. So I would definitely find a veterinarian who's interested in behavior work, interested in, treating anxiety and some of these other things, someone who has time to sit with you and talk about these things. So there's boarded veterinarians that do just behavior work, but there's a lot of general practitioners like myself or others that are interested in it or have done, like some other people have done some pretty extensive training on it. And so if you work with someone like that, you can do supplements, you can do medications, and work with that. There's also, in addition to just her question about anxiety, there's storm phobias, there's noise aversions, there's separation anxiety. So all those little
There's so many things that go into it.
Yeah, for sure. And you want to make sure you're helping your dog because you don't want him to suffer with that. So go ahead and take the time to talk to your veterinarian about it. There's a lot of things we can do to help them. And, most of the time it's just not a matter of taking a pill or taking an oil or whatever. There usually is much more to it. So it's usually not just a one-stop, take a CBD oil or take a pill and it's going to go away. You need to do some training and help them gain the confidence that they need to kind of feel comfortable in the world. And there's a lot of good resources online too. There's one, fearfreehappyhomes.com is one that a lot of, there's a whole fear-free movement in the veterinary world. And so that one kind of relates to what you can do at home to kind of decrease anxiety and those kind of things and work with your dog. So start there. That might be a good resource. There's other good places online, but those are other things.
Definitely lots of options for dogs with anxiety. Yeah. And that was fearfreehappyhome.com. And we will post all the answers to these questions at dogtopia.com/healthy dog in the FAQ section. So if you missed some information that Dr. Antje Joslin is going to go over, we'll repost it later. Peggy, we hope that answered your question. All right, this question also came from Facebook. Robert Summers is wondering, is it safe or not safe to play with laser lights with dogs? Interesting question.
Yeah, totally interesting question. I don't know if they're still as popular as they were a couple of years back. And certainly people use them with their cats and you think, oh, it's pretty innocent, right? You just like shine your light around and the dog can run and you can sit on the couch. But, you think, oh, okay, no problem. As long as I don't shine the light in their eye, it shouldn't be an issue. But it turns out it kind of is a big deal.
Oh, okay.
A lot of, besides the fact that your dog can be running around and doing quick, sharp cutting turns and questionable surface, they can definitely hurt their knees or, slide and kind of, or have some soft tissue injuries. But besides that, it's probably not a good choice for your dog's mental health, and it seems like, oh, well, why would that be, right?
A little crazy.
Yeah, they can only, so the chasing the laser light kind of activates their prey drive. And I think Colleen has talked a little bit about prey drive and that kind of stuff in her talks. So this activates that, and so they're chasing this laser light, and they can never really catch it. Yeah. So normally if they're having their prey drive, they're going to try to catch their prey, and this is a never-ending game for them. So it quickly can get kind of frustrating because they're not able to catch it. And so what can do, especially dogs that are really driven, it can lead to kind of an obsessive compulsive behavior for them. And so they will start doing shadow chasing or light chasing, or they'll stand at the spot where they last saw that laser and wait for it to come back. Or sometimes, there's some dogs will do destructive things, like they'll start digging at that spot and looking for it, So, that gets to extremes. There's dogs that have really, done some damage at home or to themselves, but you don't want to necessarily go down that road. Yeah. So I would say try something else, playing. If you're looking for something where you're not moving so much, maybe dog daycare would be a perfect thing.
That'd be a perfect thing.
And, or, tennis ball, or taking them for a long walk, or playing fetch or something else. Another good thing, we were talking about on the website were games that you can do. So, if you have a couple old boxes, you can put a toy or food in the box and they can try to flip the box, get into the box, things like that. That keep them mentally entertained.
Stimulated.
Yeah. And they can get that result. Like they can dig it and flip it over, and now they found the treat, instead of something where they never have any.
Yeah, you don't want to make them crazy.
Yeah, so we don't need to, make them obsessive compulsive. But yeah, it seems innocent enough, but probably pick something else.
Okay.
Yeah.
Thanks, Robert, for submitting your question. We hope that we answered it for you. All right, this question came from Jill Andres via our Healthy Dog site, dogtopia.com/healthy dog. She's wondering about her yellow lab that she just adopted, who's 9 years old. Mid-January she adopted. Needs weight management, currently weighs 83 pounds, has arthritis, knees, elbows, or in the elbows, no dysplasia yet. Best weight management food and how much daily should she be giving him, plus recommended doggy treats. And she has a similar question for her Yorkie weighing 12 pounds. And this is also similar to Lisa, also via our Healthy Dog site. She's wondering about her 3-year-old Sparky, who's a Chihuahua Yorkie mix, also looking for the best diet to help with weight loss. Has arthritis in both back legs. He can't walk much, and it bothers him so much it hurts him to walk. So both of these dogs, or all of these dogs, need some advice.
Okay, so there's some really pretty good prescription diets out there now, and what they used to do is kind of focus on one issue at a time. It seemed like you had a urinary diet and you had an arthritic diet and a weight loss diet, And some of them have come out with some good combo diets because a lot of times these things go together, right? You're an overweight dog.
Yeah, you're not exercising.
You have arthritis, and you can't, whatever came first, arthritis, now you're overweight or, whatever it is. But so, for example, Hills has a metabolic and mobility diet. And so that their metabolic diet is really good for weight loss. And that diet, comes in canned and dry. And, so a dog that is 83 or 80 some pounds, you can always look at that bag, but I still feel like sometimes they kind of overfeed. But so like 3 to 3.5 cups for, an 80 some pound dogs, and maybe 3/4 of a cup for the small Yorkie.
And that's per day.
Per day. So
okay.
You divide that up however many times you
want to feed them.
Yeah. So again, I think we talked last time about, the amount of food you feed, but then she was asking about treats. So, you're adding calories in each time you give those treats. So you probably want to pick something that's pretty low calorie. So if you really need some treats, maybe some veggies.
Yeah, some carrots.
Carrots. Carrots kind of higher in sugar, but that's fine too. Like something that's filling, carrots, green beans. If you wanted some protein, just some lean, boiled chicken, things like that. I also, for some of my arthritis dogs, really like the glucosamine chondroitin supplements. So some of these diets will have it in there, but a lot of times it's not quite enough.
Okay.
Or fish oils. A lot of them will say, people will tell me, oh, I have fish oil in my dog food. Well, there is some in there, but it would be really oily if you had enough in there. So a lot of times, you want to talk to your veterinarian about, hey, can I do some extra supplementation? And I've had people say, oh, in humans, the studies haven't been so great on those glucosamine chondroitin, but there have been some studies, especially in horses and stuff, that have shown that it kind of helps. And it certainly, I think, in most cases, doesn't harm. If you have some other issue, kidney disease or liver disease, you maybe want to talk to your veterinarian about that. But for the most part, a good glucosamine chondroitin supplement. I love 2 of them. There's a Ficox Max, which I use for my dog, and I like the Dosaphasaquin Advanced too. Different things, in them. It's not just glucosamine chondroitin. They have a lot of other anti-inflammatory things in them. So, when you read the bottle, you'll see a whole list of things. If that's something, that you're comfortable with, and you can talk to your veterinarian about them. Those are both through your veterinarian. I think they work great, and most dogs like them. They're chewable. They can be a little pricey, but
definitely helps.
Sometimes, more, less expensive than, having to take some other medications. And then I also am kind of a fan of the essential fatty acids. So the omegas, the fish oils. And, again, you can talk to your veterinarian about how much and which supplements they like. I like the Well-Actin product, and I like the Nordic Naturals for dogs and cats. I always tell people, with the fish oils, you kind of get what you pay for. Some fish oils can have a lot of, heavy metals, and you don't want to get something real cheap, but maybe have things in there that you wouldn't want. Yeah, exactly. But with the fish oils, so those are oils, right? So you're adding calories. So keep in mind that when you're using that and you're trying to lose weight, you want to balance the amount of oil calories with the amount of food you're getting, especially with the tiny, little Yorkie. You're like, 8, 9, 10 pounds, every calorie counts. So those are some good diets. And, mobility is important. If you can get these guys to move around, maybe swimming pool. We use that here a lot in Arizona, but depending on where you live. And then with a 3-year-old, I would definitely talk to your veterinarian if it's in the back knees. Yeah, young. I mean, is it something that surgically can be helped? Do they have some of these little guys have really wiggly kneecaps that, surgically can be helped sometimes quite a bit. So I would kind of
see the other options.
Yeah, what else you can do for
interesting
the little ones.
And fish oil has other benefits too, right? So
it's not just arthritis. For sure. Like the skin, it's really good for your skin and your heart and your brain and probably those kind of things. So that there's some anecdotal evidence in people, that if you ever had surgery, they'll tell you to stop taking your fish oils ahead of time. So if you're taking a lot of the dogs maybe are taking certain NSAIDs, so non-steroidal anti-inflammatories, you might want to ask. There's some discussion about whether that can affect clotting factors and stuff. I think you're probably pretty safe.
Yeah.
You'd have to take a really high dose, but they are good for lots of things. That's kind of a thing.
Yeah. All right. Well, we hope that helps all of the doggies. Jill and Lisa, thank you for your questions. All right, this is about heart murmurs. My dog was diagnosed with a heart murmur. Should I be worried? So I guess, what is a heart murmur? Do you want to go into that a little bit?
Yeah. So, yeah, I mean, it can be kind of scary. You're like, oh my gosh, a heart murmur. And just like in people, there's ones you need to worry about and probably ones that you can kind of put off for a while.
Okay.
And, the dog's going to have a long, healthy life. So if your dog was diagnosed with a heart murmur, it was really likely, your veterinarian's listening with the stethoscope and you hear this whooshing sound. And so, that's kind of the blood swirling there that way it's not supposed to. So it's not always a reason to be concerned, but certainly can be. That whooshing sound can be from a leaky valve, a heart defect, weak heart muscles, heartworm disease, tumors, infections. So there's more than one thing that can cause that. Although none of them are really considered normal, there are not always a cause for concern. So there are definitely a large majority of dogs that have mitral valve disease. And like I had a dog, had it his whole life, didn't end up dying from mitral valve disease.
Okay.
He did end up on heart meds later in life, but still was well maintained. But that doesn't mean there are certain breeds where if you start hearing these murmurs, like the Cavaliers, Spaniels, those guys, they decline pretty quickly. So if you have a breed like that, you want to be on top of it and start medications pretty quickly. But I always tell people, it's good, especially if even if your vet said, hey, it's nothing to worry about. You can always get it checked out, get a cardiac ultrasound, do some, blood work. We have these tests where we can see, about heart function based on the blood work. And certainly, get a starting point, get a ECG, ultrasound of the heart, something that most veterinarians offer.
Mm-hmm.
We can go to cardiologist. There are definitely some that you'll hear in a young dog, really young puppy, and then they kind of outgrow it.
Oh, okay.
And I think that happens in humans too. Like they have them as children and you kind of outgrow it. Those guys usually are, nothing to worry about. So you can wait a little while and see, but certainly if it's a significant murmur in a young dog, you want to make sure that, it's not something that they were born with that may need surgery or get worse. So, I don't want to scare anyone, but kind of take them serious and then find out, okay, maybe I don't have to worry. But certainly if your dog has a heart murmur and all of a sudden you're getting coughing, congestion,
other symptoms.
Yeah, changing in breathing where all of a sudden they're like breathing really fast all the time and they can't, slow their breathing down. If they're having exercise intolerance where they just, get tired really quick, can't do stuff. If they're weak, if they're fainting, if their, gum color turns gray or blue. If all of a sudden they have abdominal distension, like, oh my gosh, they have this pot belly, like there's fluid in there.
Okay.
Or lethargic. Those are all
symptoms.
Signs
Yeah.
I mean, you should not ignore those anyway, but certainly in a dog that has a heart condition. Yeah.
Okay.
Take those serious. So.
Serious question. Thank you.
Yeah.
All right. Another question via Tracy Richardson. She submitted this dogtopia.com/healthy dog. So if you haven't been, please visit and submit any other questions you might have related to your dog's health and wellness. We'll be happy to answer them. Tracy is asking, do you believe in the slow kill method of heartworm treatment? If not, why?
Okay, so I guess it's not a matter of believing or not. It's just, not the best form of treatment for heartworm disease. Heartworm disease, is definitely one of those that is best prevented than to have to treat. So by all means, like if you, get your dog on some heartworm prevention.
Before.
Yeah,
always.
like all, yeah, it's just one of those things that we way easier to prevent than to try to treat. There's some real, we've had heartworm prevention on the market for a long time. Those low-dose ivermectins have been around, like HeartGuard, for a long time. There's newer products. There's injectables now. But even those are safe for even the ivermectin-sensitive breeds. Some of those, low-dose ivermectins for the dogs that have this multi-drug resistant gene. But anyway, so let's try to prevent it for everyone else out there whose dog doesn't already have, unfortunately got diagnosed with heartworm disease. It can definitely be deadly. And at worst case scenario is that your dog, passes away from it. But even best case scenario, you're looking at heart damage and pulmonary vasculature damage. So whenever possible, I would definitely recommend being treated through the American Heartworm Society guidelines that use the adulticide, the melarsamine. That's the one that's approved for it. And it is, kind of a lengthy protocol. I mean, you're treating the heartworms, but you're also treating some other things that go on with the disease. And, if for some reason they can't follow that protocol, I mean, we certainly have had years where we weren't able to get that, so we had to just do the slow kill method. Or, I mean, certainly if there's shelter situations where the shelters just don't have the funds.
Right.
I mean, it's expensive to treat. So, it's better than nothing, but it's definitely not the kind of the gold standard, the number one way to go. And the reason that we don't do the slow kill method, because it's almost bad to say, but it's sort of slowly damaging the heart and the vessels more, because you're looking at, continued damage to those organs and those vessels and things like that. So even like the Heartworm Society, if you go on their website, and I kind of quoted some stuff off there, but it is, even after 18 months of treatment on the slow kill method, they're 18 months or longer, up to 30 months, they're still having it's only killing 90-some% of the worms. So you're still having some in there, and they're still causing damage. And then during this whole waiting period, that you're waiting for these worms to die off, because that's basically what you're doing. You're just allowing no new worms to come in, but the old worms are still and they have to live their life and die off. And so that whole time you're having damage to the heart and the lungs and the pulmonary vasculature. And really that whole time too, your dog has to be on, strict rest, because you have these heartworms in there.
Yeah.
And so that, and you can kind of be still spreading them. And when you do that, you're starting to see some resistance actually in the heartworms. So
as with any disease,
with a lot of diseases, and it's starting to happen with not just the bacteria that we hear about with antibiotics, but with some of these other things that we're getting resistance, and heartworms can be one of those.
Yeah.
So
better to prevent than to treat.
Yeah, but if you have to treat, that's why definitely I would not recommend the slow kill method unless that's the only option. Yeah.
All right. Well, thank you, Tracy, for submitting your questions. Let's see if anyone has submitted any questions. Doesn't look like it, but we appreciate everyone who has tuned in today. Once again, we'll answer all of these questions online as well. So if you missed some of Dr. Joslin's wonderful information, we will answer it at dogtopia.com/healthy dog in our FAQ section. So visit there. You can also visit our blog for wonderful recipes, DIY ideas, tips and tricks, dog behavior, all the good stuff to keep your pup fit and furry for life. We'll see you guys next week with Colleen Demling, our dog behaviorist. So submit any questions you have related to dog behavior, dog training, barking, chewing, all of the above. She'll be with us next week at 3 p.m. Eastern. So same place, different time. We'll see you next week. Thank you.
Bye.